So, in our last videos, we have finished reading about the anatomy of the intra-abdominal wall. Today, I'm going to start with a new topic, that is perineum. So it's very important to know the anatomy of the perineum. So, it's a diamond-shaped structure which is present, and it has been divided into urogenital, triangle, and one more is anal triangle. So I'll just start with the boundaries of the perineum. So the boundaries, see, in the front it is having a pubic bone. Next to the pubic bone is your ischiopubic rami on both the sides. And here backside is your sacrum and coccyx. This is your sacrotuberous ligament on both the sides. Okay, so now I have told you two triangles are the urogenital and anal triangle. So this will be your urogenital triangle and this will be your anal triangle. Okay, now let me talk about something called as pelvic diaphragm. So pelvic diaphragm is formed by certain muscles, which is your levator ani muscle. So this levator ani forms your pelvic diaphragm. This is your pubic symphysis, and here is your urethra, vagina, and the anus. This is your sacrum. So this pelvic diaphragm mostly contains your levator ani muscle. This levator ani muscle is formed by your pubococcygeus, iliococcygeus. Okay. So I'll just tell you, pubococcygeus, again it has been divided into pubourethralis, pubovaginalis, and then puborectalis. So pubourethralis means this from the pubic symphysis. It surrounds your urethra. So this is known as pubococcygeus. Understood? Pubococcygeus का part pubourethralis, and next is your pubovaginalis. So this is your vagina. The one which covers your vagina is your pubovaginalis. And which covers your anus or the rectum is your puborectalis, or analis, which I'm going to draw now. This is your puboanalis or puborectalis. Okay, all these three are the modifications of your pubococcygeus muscle. And other muscles are your, okay, wait, this, I just wanna, this is your pubovaginalis or puboanalis. This is. Now what you have is iliococcygeus. So this is your ileus. So from here it goes to the coccyx. That is why it is called as iliococcygeus. And this is your ischium, this part. So whatever the part attaches this to the coccyx is your ischio-coccygeus. Okay. And this is your iliococcygeus. So overall, all this thing is your levator ani. Understood? Now let's go to the structures within your perineum. Okay. So what are the structures in the perineum? So outside, whatever you see in the superficial perineal pouch is your perineum, which I'm going to talk. So you know there is a vestibule which contains labia, minora, majora, and all, which I'm going to draw now. So this is your clitoris, and this inside is a urethra. This is the vagina, and next to the urethra are your paraurethral glands, and here in the vagina you have a vestibular glands, and outer to this is your labia minora. So this is your labia minora. The posterior part is known as posterior fourchette. I'm telling it properly. It is known as posterior fourchette because later I'm going to tell you something else in posterior. So this is your labia minora, and outer to this is your labia majora. This is your labia majora, and the posterior meeting point is known as posterior commissure. So just remember the difference, fourchette and commissure. So anteriorly also they meet, and this is known as your frenulum of the labia minora, and of this labia majora it forms prepuce of the hood of your clitoris. It covers the clitoris. Whatever the red color is saying, it's a clitoris. And the gap between the vaginal opening and the posterior fourchette, this is known as fossa navicularis. Okay. So this is your labia majora, and inside to that is your labia minora. This labia minora, special thing is that it has no sweat glands or apocrine glands, also acrine or any hair follicle, whereas your labia majora has hair follicles and sweat glands. Okay, there is something called as Hart's line. Outer, it's a junction between the outer 1/3 and medial and lateral half of the labia minora. Understood? So I was just telling you about clitoris. This is your clitoris. This is around 2 to 2.5 centimeter in length. So when do we say there is a clitoromegaly? When this is more than 4 centimeter, then we say it is clitoromegaly. And I also told there is something called Bartholin's gland. This Bartholin's gland is present between your labia majora and labia minora. Okay, these are the pea-sized glands, and they drain at your 4 o'clock and 8 o'clock position. They are lined by columnar epithelium and transitional epithelium along with non-keratinized stratified squamous epithelium. So, see, the function of this Bartholin's gland is that it secretes alkaline mucus at the time of intercourse. Okay, alkaline mucus at the time of intercourse. And usually, if it is seen in people more than 40 years, or if it is more in postmenopausal women, or if it is a solid mass, then you should suspect some malignancy. Okay, otherwise, if there is any swelling at the Bartholin's area, then you can examine and see if there is any pus collection. If there is a pus collection and patient is symptomatic with pain, tenderness and all, then you have to go for IND, incision and drainage. So you have to differentiate this Bartholin's from Gardner's cyst. How do you know? How do you differentiate? See, I have already told you, they are usually at 4 o'clock and 8 o'clock. That too between labia majora and labia minora. This Gardner's cyst can be anywhere, and mostly they will be anteriorly, and this is how you differentiate it from the Bartholin's cyst. Okay, and I have already told you this anal triangle and your urogenital triangle. So at the junction of this is your perineal body. This perineal body, it's a body which has attachment of certain muscles which supports your supports your rectum or anus, and also the prevents prolapse. So what are the muscles attached to your perineal body? See, there are superficial muscles and deep muscles. So what are the superficial muscles which gets attached? That is your bulbospongiosus, next superficial transverse perineum, and external anal sphincter. Deep is your perineal membrane and a portion of pubococcygeus, internal anal sphincter, and deep transverse perineal muscles. Okay, so this was about the perineal body.